I came back and I said, I'm gonna follow this up by fact checking the fact checkers. They say that, as you said, this is evolving science. It's going so fast that everything I had said was considered, their words, old data, old science. I mean, old science is like something from 40 or 50 years ago, not 6 years ago, not 2 years ago. But let's set all that aside. And so we look at a study from the CDC published on behalf of the WHO to make recommendations to the WHO in May of this year in regards to this coronavirus pandemic. So it's clear as day, crystal clear, that focuses on whether or not masks work. And what the study found was 3 very important things. Number one, that if you wear a mask, that there is no evidence that wearing a mask versus no mask reduces the chance of getting a virus. Yes, it reduces the chance of projectile coming out of your mouth. Yes, it reduces the amount of spittle that you're going to get on other people when you're talking to them. That's true, but that's not what the study is looking at. The study is looking at transmission of virus. Virus is not transmitted merely by you're talking to someone too close and you got spittle on them. It doesn't work that way. And so the idea that because you're covering your mouth, you're now protected, that's psychological, but that's not science. Science is saying, these studies are saying that they do little to nothing to decrease the amount of contagion from one person to another in terms of the person who is sick, who is transmitting it to someone else, or the wearer who's trying to wear it for protection and not contracting the virus. It found that there was no evidence, that's the word that they use, of that happening. And then the other important issue, and I think this is so important, is the study also shows that if you're wearing a cloth mask, you're actually putting yourself at greater risk for infection. Because number one, the cloth mask has no N95 respirator on it. It is a poor design. It's loose fitting around the face, which means those virus particles are able to get in. You're not stopping that from happening by wearing this mask. You might be stopping, large projectiles, but you're not stopping virus. And that the fact that we're constantly adjusting and touching it means that we're actually at risk of becoming infected at a greater rate than not wearing a mask at all. That's what the science says. And yet you have these deniers who are coming out and saying, no, that's not true, not true. This guy doesn't know what he's talking about because masks absolutely, absolutely work. But they're basing that on what they hope to be true, not what actually is true.